one of the things we see happening increasingly is that in order to give the best care to patients, we have at one end of the spectrum where care is very specialized, we have to get the right specialists together to make those judgments. So, we have something called, multidisciplinary team meetings where people get together and discuss individual patients, their problems, and what the best approach is to look after them. As we have moved forward over the last few years, what we've seen is that there are certain services where that's happening at a bigger scale. And so the teams that need to get together are not just in one hospital, they're across multiple hospitals. They're not just in one part of a region, they may exist across the whole of London. So if you looked at stroke networks in the main hospitals now in London, I think there are 5 hospitals that provide interventional stroke services, then they will get together on a regular basis to discuss complex cases, the specialists in those areas. What this means is then that the services we provide for them to be able to see all the data, have those conversations, need to work very effectively. So that's about making sure that they can have a proper conversation and exchange views and thoughts about what the best steps are. And this extends the previous conversation that we had about not just making applications and data available at any point in any time, but making sure that there are sufficient opportunities to collaborate easily, that haven't got technological barriers, but are technologically enabled and the user interface is easy to use around those things. Again, the pandemic's helped that somewhat. And what we see, particularly in the end user device market, is that those devices have started to make that much more easy. I mean, for instance, we all use this sort of approach in our non-working environment. If we want to, have a conversation with 3 or 4 friends, we can easily call them together on a whole range of different applications on our phone or tablet or PC. And it's just getting to that same level of ease at the work level, same level of reliability, but really critical, because I come back to, one of my views, which is really the technology is one thing, but if we can agree to do the right thing, we have the chance of really improving services and the way care is delivered. But then getting humans to support that and working through all the emotional barriers that we have around those is the harder thing. So I think the human side of this can be harder still.